This is a podcast about the power of lived experiences, about how stories can shape more human-centered systems, spaces, and services.
Each episode, we sit down with people who are challenging the status quo, leading with empathy, and helping others through their work and their stories.
We're Farah and Megan, and this is Collected by Unimco. Today on Collected, we're joined by Jen Patterson, who is a co-founder, a businesswoman, an advocate, and her personal experiences led her to co-found Coven Women's Health. Jen believes in the power of lived experiences, and we're really excited to have you here, Jen. Welcome.
Hey, it's so fun to be here.
Yeah, so exciting.
So why don't we start at the beginning, Jen, and maybe hear a little bit about your background and your experiences and really some of the drivers that led you to co-found Coven Women's Health.
Sure. Like, how far back do you want me to? Well, like my whole resume, or should we just dive right into kind of more of a...
I want to know.
Yeah, we'd love to hear about your background because we know that you spent some time, in financial services, in advertising at Google. So just really some of that and the path that you took.
Yeah, my path was definitely not linear. And we talk about this a lot that, when I was growing up, there was really this notion of like, have a goal and you work towards it. And, my father was an entrepreneur, but he found early on something that he was so passionate about. And he worked at the same company for like 45 years. So in my mind, I was like, okay, I have to eventually figure out what I want to be when I grow up. And I laugh with Michelle because Michelle, I think, always kind of inherently knew that she was destined to be a physician, but maybe didn't put a definition to it really early on. Whereas honestly, like I was not academic. I really just I did sports. I liked being social. I never really thought that much about what I want to be when I grow up. And I came to it later in life, I would say. After I graduated from Phil, I kind of fell into advertising. It was very a la mode at the time, very fun. Yes, not Mad Men, but
Mad Men-esque in some ways.
It's like some of the parties were like,
yeah,
as appropriate.
Right.
Like, we partied a lot. We had a lot of fun. I made some great friendships. But then at a certain point, I was like, is this it? And, I worked with a very diverse group of clients, and I was like, oh, I kind of like what they do because, they get to hold the budget. They make more of those strategic choices. So then all of a sudden I was like, I should go to business school, which is hilarious because I had a philosophy undergrad and I was always really strong at communications and writing, and a total fish out of water in business school. But again, some of my best friends we met at Rotman, and I really leaned into life at school at that point. Was president of the marketing association, ran for student council. All my friends who knew me from high school were like, what? I don't know. I think I'm into this.
Yeah. Sometimes I feel like I'd want to do over too, just like the opportunity to go to school again.
Yeah. After business school, I had a stress dream about it last night. I never had them while I was at school.
Oh, yeah.
I was so stressed because your first year at Rotman is like 4 finance courses, had 3 accounting classes. And I'm like, I don't know how to do any of this.
Right.
And so after business school, again, it was this notion of like, okay, so you've gone to business school, you want to work in marketing. So the ultimate goal should be like chief marketing officer. So then I obviously didn't jump into that role, for very obvious reasons. So I went to TD and I did one of their leadership programs there and worked in marketing and strategy. And after that, I went over to Google, which was an amazing experience. That was where I think I kind of got that first taste for entrepreneurship. I ran a conference called the Go North Technology Conference that was really early days of AI, but my job was to essentially find speakers and applications for AI across different industries.
Very cool.
That is cool. And early on too, right? With the AI. Yeah.
Very, very early.
Yeah.
Pre-ChatGPT days.
So much. This was 20. With Sophie Gore. This is 2017, 2016.
Yeah, where I feel most people probably couldn't define AI at that time.
No.
Yeah. And so that was our job. And it just exposed me to all of these phenomenal minds and entrepreneurs. And so after I had Sophie, and unfortunately I lost my father when I was on mat leave. So it just kind of led me to once again really reflect on what do I want to do? And again, because my father was an entrepreneur, like I'd like to do something like that. So I actually kind of through my network joined Nest Canada, their chief marketing officer. Do you know?
We've been to a couple events at Next.
Yeah, so I love them. I'm still close with so many of them and the entrepreneurs there. It was one of Canada's very first accelerator programs. So entrepreneurs would apply to get in and get education funding, mentorship. And so my job was really to elevate them and the Next Canada brand. So another great, amazing job where I got really immersed in the tech ecosystem and just exposed to all these entrepreneurs. And then flash forward, pandemic hit. And my sister owns Cafe Plantain, which is a food service business that was primarily located in the downtown core. And the pandemic just decimated her business overnight. So I was like, wow, this feels like a really good time to quit my secure job and go in and work with my sister. And it was wild. Like it was very humbling. I went in with, my little toolkit. Well, like you try going into a cafe environment or like into a kitchen and trying to like motivate a team the way that you would have in the corporate world. Like I learned a lot. He's such a phenomenal, heart-led small business owner. And ultimately she just, the pandemic clapped with her. It was really fight or flight. I know you're going to have Kate from that bar on. I'm sure she can share the experience that she had during that time. Like it was, I almost feel like you blacked out for a couple of years because it's just a lot. So we parted ways, like obviously very amicably. I was like, listen, you're my sister, you're my best friend. And as much as it pains me, I will walk away from the business. And then, that brings us to kind of really the start of this journey, which was once again reflecting on what do I want to be when I grow up? Do you want me to pause or can I just keep going on this next chapter?
Yeah, let's hear what Coven's Women's Health is all about.
Yeah, so I, at that time, from a health perspective, was pretty bad. Like my headaches, my headaches started 10 years ago.
And were they, when you say out of nowhere, like, like we all get headaches with our periods and like tension headaches, was this just like a different type of headache that you had?
Other than hangovers, is like, let's be real.
Yeah, for sure.
I'd had some, beside like the day I turned 30, I tweaked something in my shoulder blade, like literally like 2 days after I turned 30. It's like, cool. And so I never had the headaches, but I remember like going for massages or working with the chiropractor. Like, so you don't have headaches? I was like, no. And then, we went on this very magical boat trip in the BBIs with a whole group of friends. This was pre-children. And we lived on the boat and I felt a bit like out of sorts. My friends have always made fun of me because I have no inner monologue. And so I had to tell everybody exactly how I'm feeling. And I would be like, oh, I feel woozy, and everybody's like, oh, Jen, how's your stomach feeling today too? It's like,
and you're on a boat and you're probably drinking. So,
and then we got off the boat and I went back to work and I was like, something doesn't feel right. Like I would be in meetings and I was a TD at the time and it would just feel like this creeping sensation. I had like a swelling, but as a overachieving, 30-year-old, like this is fine. I did eventually have to go on sick leave though. It just got to the point where I was like, and it's hard to describe to people. I've spent a lot of time trying to describe what my headaches are like. Yeah, it's not a traditional migraine. It's like a crazy pressure in your head. It feels like my brain is pushing up against my skull.
So does it hurt? Is there pain or is it just like this like
it varies. Like, and this is where, I started after having Sophie, I noticed things were feeling very cyclical. That all of a sudden I was like, okay, I've got this a little bit under control because I'm very much an advocate for myself and my health, and went back to work. I still, even when I was at Google, I was having headaches every day, but I was like, this is fine.
Well,
it's not fine. This should just be like this is totally cool. You're not expected to talk about it. You're expected to just
normalize it. It's part of, it's just part of it became part of your everyday, it sounds like.
Yeah. It was like, I guess this is just my lot in life. And then after SOS and my period came back early because I wasn't very successful with breastfeeding. So SOS is on formula and my period came back and I stopped sleeping. And that was my first instance, I would say, of like a bit of medical gaslighting. Like it had happened definitely when the headaches first started because I was trying to, obviously as a Canadian, you're like, okay, well, I'm going to try to tap into our public healthcare system because why wouldn't I? So I went to a GP. I don't know what to do with you. Put in for a referral for a neurologist. Waited forever. They wouldn't give me an MRI. I literally had to go to Emerge.
Oh my gosh.
I know my body. And even if it's nothing, and I'm sure it's nothing, I want that peace of mind. And it is my right.
Totally.
As a Canadian.
As a person. Yeah.
As a woman, you know? So I ruled out all that stuff. I had a neurologist basically look me in the eyes and be like, you're a type A woman and you need to just relax.
Okay. But like, how, when you have a headache or like any internal pain, like it's so frustrating that they can just say to you, like, you're fine, you're type A, like, do the test and then tell me.
Well, and I'd love to hear more about your experience with the Crohn's, and I'm sure you've talked about it because I have friends who have also had like irritable bowel or stomach issues. And it's interesting because my sister-in-law is a gastroenterologist in the States, and I'll tell her about the rigmarole and the red tape that I'm sure you had to and my friends had to go through to get a test.
Yeah.
We're like, get a colonoscopy. And she's like, sorry, what? Like,
I know. Yeah, it took me 2 years to get a diagnosis because I wasn't getting any of the tests to see, okay, what's going on inside your body.
You're right.
That's insane.
Yeah, it is insane.
And for migraine, now I know what I know. Some women, God, it can be like, how long did it take? It took me 7 years to meet my nurse practitioner who then really was instrumental in helping me understand how personal. Also, she put a name to it because I was like, this isn't migraine. Like I'd had one migraine in my life where it felt, like a knife was digging into my head. And so I always thought that was a migraine. So dispelling that myth, helping put a name on what I was experiencing, it was the first step.
Yeah.
Yeah. And I think that's so important. The language that we use not only to describe the type of symptoms or pain that you're experiencing, but even, when someone talks about a headache, it almost seems like there's really just two kinds of headaches. There's a migraine, which conveys the seriousness, right? A migraine is serious. A migraine is bad. But outside of that, having a headache seems almost not significant enough. And so I appreciate the ability to really be able to describe and express what you're going through, because I think especially for healthcare providers and practitioners, I don't even think that they necessarily are equipped to understand the different types of headaches that people experience or the different types of pain and symptoms.
Yeah. And in their defense, they don't get the training, they don't get the education, they don't have, I was saying earlier, I learned so much about our healthcare system and how OHIP works. And, if there isn't a billing code to facilitate a conversation, if they can't build that conversation to OHIP, it takes someone very altruistic and compassionate to actually go above and beyond and take the time to listen and validate. And so, by the time, so I was on Dr. Michelle Jacobson's wait list for 2 years because my sister has endometriosis. She was seeing a colleague of Michelle's who's phenomenal for endometriosis. And my sister was like, I've heard Michelle is amazing. Because at this point, like, I'm a data person and you talk about the importance of language. I think data is also really important because data is power. Go to your physician and you say, okay, in my Clue app, or don't get me wrong, they can still dismiss you and go and say, I have a headache for the 3 days before I get my period. I also feel incredibly depressed. And then you can also say, okay, and then on day 8 of my cycle, I also have a 3-day migraine. And it's every month. Oh, and also when I ovulate, I have a 2-day migraine. And, so you can take that data.
Yeah.
And so I was like, okay, this has to be hormonal. There has to be something going on. And my doctor was like, well, how old was I at the time? I was in my 30s. And she was like, well, you're getting a regular period, which is now all of the women who come to Coven Women's Health. I would say 90% of them who are in their early 40s or late 30s or have been systemically dismissed because, once again, their primary care provider doesn't know enough to say there's more than just menopause.
Right.
There's perimenopause, which can start for some women in their 30s. And Michelle is so good at, it's about the symptoms. It's about your lived experience. It's about listening and looking at those breadcrumbs.
And trying to make sense of them.
Yeah. And even if you can't pinpoint what is going on, like the first step is really listening and allowing a woman to describe that experience. Now, again, by the time I got off Michelle's wait list, at this point I was working with my nurse. I had found my nurse practitioner. For anybody listening, I didn't know about nurse practitioners. They're angels. Honestly, they're, again, not all doctors are created equal. There's some great neurologists out there who also work at the intersection of women's health or menopause. But again, they're a rare breed. Nurse practitioners are much more, they'll often be quite niche. So they'll have an area of expertise and they spend so much time being educated. And the woman that I see, she's a nurse practitioner, Christy Tate, I would say she's top in Canada in terms of migraine and headache. And I'm sure we'll talk a lot about community. I met her. So my sister and I had opened a location at the Cafe Plenty on the Danforth. She was our first customer.
Wow.
She and her husband came in, office read. They ended up spending 3 hours at the cafe. And we got to talking. And I was like, this feels like we're meant to.
Yeah.
Okay, so she came before you worked with her.
No, I was still really struggling at this point. But I had a great acupuncturist who, again, was referred to me. She's doctor of Chinese medicine. She was an MD in China. So she had really helped me. But I was still stuck in that, pretty chronic space. And Christy just opened up a world of possibility. We started doing Botox for migraine. She introduced me to preventative drugs. We worked with supplements. It's a very holistic approach. So she was our first customer at Plenty. And now we collaborate with her.
That's awesome.
Because we'll send, again, I could talk all day about headaches. I know we want to cover other ground, but unfortunately, as women enter the menopause transition, I now have so many girlfriends who are starting to get hormonal migraines before their period, and
I get them. Yeah, not migraines, but I get hormonal headaches around my period. It's I know, especially the day right before my period, I get a headache, and I have PCOS. So and I want to talk to you about PCOS and what you're doing at Coven. But now I always know, my periods are so sporadic that when I get a headache, I'm oh, I'm definitely getting my period tomorrow. And if I don't, I'm oh, come on. This is my little breadcrumb.
And again, there's so much you could do in those. When I finally got in to see Michelle, number one, she was the first physician who looked me in the eyes, and I sat there and cried because she was so warm and caring, and she spent more time with me than she probably could have built.
Right.
I think I was just so grateful to have someone listen to me. And the first thing she said was, of course, this is hormonal.
Oh my gosh. That's so nice to get that.
Feels so validating.
Yeah.
Right? All these time, I thought it was just in my head.
So you met Dr. Michelle, you became a patient, but now you guys work together at Coven. So can you tell us a bit about how that relationship changed into becoming entrepreneurs together?
So when I started seeing Michelle, it kind of coincided with this next chapter of career exploration for me. And you can tell, like, we lovingly call me the dumpster fire, not just the headaches. I've struggled with PMDD, premenstrual disorder. I also just, from a hormonal perspective, am very clearly a perimenopausal woman. So when I was reflecting on what do I truly want to be when I grow up, I was like, you know what? I love food and I'm an absolute foodie, but plenty was really my sister's passion, right? So I was like, what's my passion? And I've always really loved informally, whether it was in a business context, like mentoring or coaching other women, or when I was in business school. And then with my migraines, like the amount of women that friends had sent my way just say, oh, you have to talk to Jen, and like I'll always make time. Like I had like an hour-long conversation the other day with a woman who's not even coming to Coven, and I was like, sure, like let's talk. That this was like, okay, what can I do in this space? And so my superpower is more bringing other people's ideas to life. So I wasn't necessarily like I'm a strong operator and brand builder. I was like, I don't have to do my own thing. So I kind of launched myself into looking at who was out there, what was happening in the headache space and the women's health space, and set about that very tedious task of like a million conversation and also consulting along the way. And to be honest, before Michelle and I started working together, I was like really over it. It's like, I'm tired. I'm still struggling with my health. Like, I should just take the corporate job. And my husband, bless him, he's amazing. Like, he's truly the best partner in the world. He was like, you don't want that. Like, we've come this far. Like, keep going. And I almost let like Michelle knows this because she spends so much time at each patient when she's not supposed to, that you're often waiting in waiting room. And it's not this bad thing. It's just because she wants to spend the time with everybody. And this one day she was actually running quite late and I almost left. I was like, I had to go get South that day, I think, from pickup. And I was like, oh my gosh, like I can't. And I stayed. And it was the day that, we kind of started that transition because we both just got to chatting at the end of my appointment about our respective frustrations. And, she's the top of her field. So, of course, every other women's health venture was trying to get Michelle their gynecology practice or build their menopause practice. And she is very entrepreneurial and she was still kind of wanting to do something on her own. So it was this very serendipitous meeting. And we said, and Kirk still laughs because I came home that day. I was like, Michelle Jacobson wants to have a meal there, drink with me and maybe talk about like business stuff. And he's like, why are you like buzzing? And she's a celebrity. She's a big deal. Yeah. Anyway, so we met after one of her shifts, like long day. And we were going to be dating for a while and really liked each other. And, it was scary because at that time there was more happening in the space. Michelle and I are big advocates of, this high tides rise all ships, because it's like we are 51% of the population. Not every woman will struggle, but 3 in 4 women will experience life disrupting symptoms of menopause. So much work to be done, and there's room to play.
Yeah.
We were just at the menopause show, the National Menopause Show, and I unfortunately couldn't go. My team was like, this is amazing. We were talking to all the other women's health ventures. There's so much opportunity to collaborate. So yeah, it's, it was scary, and we were really deep in the space, but we took a step back and said, we have to do this.
And so, when you think about the actual creation of Coven Women's Health and some of the decisions you and Michelle made around a virtual only platform, can you talk to us a little bit about, how you determined what the right approach was and what your vision was in building Coven?
Right. And that's a great question, because where we started in terms of our conversation is different from where we ended.
Oh, interesting.
So much of that is due to our respective lived experience and professional experiences, because, I, as a woman and someone who is a builder of brands and had come from retail, like love physical experiences, love community. And, I think before the pandemic, I would have said, we need to have a physical space because we need to enable in-person treatments, and women want that, that touch and feel, and you can't connect virtually. But then through the pandemic, we learned, you can't beat in-person connection, that there's a lot of way to both be more efficient and still make those connections in a virtual context. But when Michelle, her experience is very different, right? Because she's always been in person, like for her clinical practice. When we first started talking, her vision was more, I want to have menopause clinics all over Canada. And what's amazing about her, and I think what works really well for us as co-founders, is that she so values my perspective and expertise from a business perspective. And so this is where I was like, I can actually use things I learned in business school. But as it was more really tapping into all the people I know who are entrepreneurs and building a business model and a business plan and looking at the numbers and realizing if our mission is really to improve access to expert collaborative care for women, we want to make that as easy as possible. We want to reach as many women as possible. We have to do virtual. And then never say never. Like maybe down the road, you might do brick and mortar, but it wouldn't be traditional, because the reality is, from a business perspective, like the overhead and just the costs associated with going brick and mortar. And to be honest, the feedback we've gotten, I think because of how intentional we are of our team and making sure that we hire for fit first, and for these women who are so compassionate and caring and go above and beyond, like we've been able to accomplish that. So, we've pivoted in the sense that Michelle, but to her credit, she was so quick to say, like, you're right, I get it. Like that's my own mental block, and let's start virtual, because it also really allowed us to get to market faster. And again, our goal was, we aren't necessarily menopause. And this was the other interesting thing with Michelle, Dr. Jacobson, is she is so phenomenal. And she's like, we all have a bit of imposter syndrome. And she's like, menopause is really my bread and butter. Like, but then as we expand into PCOS, PMDD, postpartum, like just so much experience and knowledge. And especially when it comes to gynecological hereditary cancer risk. She's a BRCA one gene carrier herself and runs clinics. So my job, again, where I started, was saying I'm good at taking other people's ideas or talents and scaling those. So I've been able to work with her to kind of say, okay, how do we scale your tremendous skill set, and how do we enable this amazing team of women's health experts who do hand-selected and trained? How do we grow that team?
And you also say in your podcast that it's built around accessibility too. And you said something that was so important, in that why should people in Toronto just why should people in Toronto just have the accessibility of getting really good women's health experts at their disposal? And now you're able to really reach people all over Ontario. I think that's so cool, because you're right. Like at the end of the day, it doesn't matter where you are geographically, like we're all having these experiences, and we should all be able to access care that will improve our lives tenfold.
Well, and those are the populations that actually needed the most.
They needed the most, exactly.
Yes.
They didn't have a machine.
Yeah.
Right.
And she, again, like she has even listen, at the end of the day, we're a private clinic. However, we're trying to think about, down the road, could we create a fund or something? What we do now is, where things can be covered through OHIP, we do that. We also will have still a referral network where we try to at least refer people out to the right practitioners. And because Michelle has spent so much time, she's very, she does a lot of education as well. So being able to help train other providers in, these more like rural communities, because at the end of the day, again, it's 51% of the population. So that's like, we're not trying to be like greedy.
Yeah. Yes. That's like how we work in that, or our mindset is that we all have to work together to really change the way that the healthcare system is and how patients are treated. And that's what unum means actually, is togetherness in Latin. So when you say like, you're not being greedy and you want to share the love, like we love that because there are a lot of different private practices in the women's health space, but like there's room for everyone. And if you can collaborate, then that's even better.
Yeah. And, Jen, as you were talking, you touched on two things that I wanted to explore further. One was, when you started talking about the decision to go virtual, you really went back to what your mission was around improving access to care, giving, trying to reach as many women as possible. And so I really love how that mission really led you to then create the kind of clinic experience that served and was true to that mission. And the second thing that this really reminds me of is this almost sisterhood and community of women, because I think so many times or let me say this again, how many times do you want to recommend a great experience, a great restaurant, a great provider to your network, right? And I'm sure when you first met Dr. Michelle, you immediately thought, everyone that I know needs to see her. She needs to see, everybody who has a women's health issue or who wants to receive care. And I think about how you've made that, or you're making that accessible for women, because if you think about the actual physical practice of some of these providers, many of them don't have the capacity to take on new patients. You spoke about the wait, even in somebody's clinic, right? Where sometimes you're sitting there for hours before you're actually seen by the provider. And I love how through Coven, you're able to get access to the best care and create that sisterhood feeling and experience through it.
Well, yeah. And, when you talk about accessibility, it's also pricing, right? That's what I was alluding to before, because you get the access, but because of how their model works and their overhead is so much higher, then you also have to kind of pay very significantly, right? So I think a big part of our mission is, sure, some people I think would probably still say, oh, your pricing is high, but like I can assure you we keep it very manageable. Yeah. And our goal is to kind of go to market with a product that is like first and foremost about the patient experience, but also making sure our practitioners are well provided for and supported. Is they are the Coven, like they are. So I don't want to call them the product, because they're not a product. They're these really amazing human beings. So, our pricing is reflective of that.
And now you have to tell us about the name and how it came to be.
It's funny because, as you know, you were so intentional about Unum and what that means to you. And Coven wasn't the first name we had. And sure.
Same.
Yes. You throw them all against a wall. Yeah. Right? To see what sticks.
Just Sophie's name way faster.
Oh, okay.
Same, actually. Yeah. With my daughters.
Did you have other names? Because for us, it was like Sophie. And I think Kirk had suggested one other name. And we were like, no, she's always going to be a Sophie. And so Coven came about. It was funny because I had it on, I did, like, because of my backgrounds in branding and marketing, I did your usual kind of like association. We had so many other names, and then we put them out and crowdsourced them. And even after all that, it was funny, Coven hadn't been on the list. And then Michelle was like, and I think I didn't put it on the list, to be honest. My mom, she's probably not, she won't listen, is quite religious. And Michelle, though, was like, Coven, I like that. I like that. So we kind of like, as she said, she chewed on it. We put it out there, and I was like, you know what? For me, from a storytelling perspective, we were both like really drawn to this notion of reclaiming power for women, and as you probably know, but maybe not everybody knows, like a witches coven was really truly just a group of like badass women here who were like would have been labeled hysterical or like, burned at the stake.
Because their headaches were like
As it was just a migraine.
they're like, I'm getting my period tomorrow.
Or, dared to advocate for themselves or what you've done, right?
Women since since Eve, if you believe in that, or hunter-gatherers have been dismissed or told they were too much or too hysterical. And so we really ultimately landed on Coven with a gentle nod to, the witches, because our icon actually has 13 little points on it.
I love that. I'm all about branding.
Oh, yeah.
I also come from that background, so I love a good brand.
Yeah.
Mm-hmm.
Yeah, it's just it's allowed us to also really have some fun, because women's health can be overwhelming and there's a lot of noise out there, but then we come from a generation where either it was whispered about or still it's very serious. And I think Michelle and I are not I'm very serious when it comes to the business, but I'm not an overly serious person. I was raised to see the light in things, laugh. And I have been through the ringer health-wise. So without humor, without my friends, without my family, what is there? And Michelle and I are kindred spirits in that regard. We have the same sense of humor. We like to laugh. And now with our team, they're like, you know what? This is a fun place to work because we like to laugh. And so the brand, I think, conveys that.
It's playful.
Yeah, I mean, that's what life should be about anyway.
Tell your friends about them.
Yeah.
Don't let your friends.
I know. Yeah.
Jen, what excites you about the future of Coven and about the future of women's health?
So much. So I think for the future of women's health, I think there's finally awareness and a lot of advocacy, whether it's here, or abroad. I mean, we won't go there, but I think it's just that there is starting to feel a lot of momentum. And personally, I don't feel alone anymore.
Yeah.
I think 10 years ago, I felt very alone. And, headaches affect millions of women in North America, much more so than men. And so even headaches are having their time in the moment, and menopause, there's still so much work to do. I think the only caveat to that is it's now being seen as a economic opportunity, and when that creates opportunity for businesses, but you also just have to be eyes wide open.
Totally.
Right? You have to know what questions to ask and really dig into, okay, what's that supplement? How is it being funded? How is it going to help me? So it's great that there are, there's a bigger platform and awareness. And I think for us, for Coven Women's Health, that there's still a lot of barriers. Michelle talks a lot about the Women's Health Initiative in the early 2000s that claimed there was a link between hormone therapy and cancer. It's been completely debunked. The media ran with it in a way that was very irresponsible. So we still have a lot of women, especially women over the age of 50, who are coming to us saying, oh, what about cancer? So what I'm excited about is getting to a point where we no longer need to be debunking, and we can just get into, okay, what is the best personalized path forward? You as a woman, whether it's menopause, PCOS, postpartum, and that's a good segue into what I am excited for Coven about is that I don't want to say menopause is easy for us, but it is because we have such tremendous expertise, but our team also has so much expertise in other facets of women's health. And I started by saying our mission is really to support women at every life stage. At some point, I'd love to be able to even support parents supporting their daughters through puberty.
Oh, that'd be cool.
Yeah. I'm sure, I don't know about you, Megan. I think for me, there was probably always little breadcrumbs of maybe I was going, I had horrible cramps as a child. Still remember my sister screaming in agony. She's 6 years older than me. And I just it was so heartbreaking. And if someone could have intervened or been curious or investigated earlier on, she might have been able to have children of her own. Like,
Right.
so you really have to go all the way back. And you talk about community and advocacy. I think like starting with the next generation in a way that I think supports the parents and support your children.
Yeah. Well, I feel like we could have so many different themes within this episode and like continue the conversation because there's so much to talk about. But we're just really happy that you were able to chat with us today and bring your knowledge. And we're so excited to see where Coven goes. And I'm personally excited to check out Coven for my own health.
Same. And we'll also make sure that, we, after this conversation, that we provide, the access to Coven Women's Health as well as to the podcast that you are.
Oh, yes. Which I love the name, Hysterical.
Hysterical Women. Yeah. Yeah, it was another fun one.
Yeah, it's so good.
And I am very excited to hopefully collaborate with you in the work.
Yeah.
Because I think, again, like high tides rise all ship.
Yeah. Thank you so much, Jen. Thanks for being here.